Here is my audience. Cancer can be a ruthless and unpredictable disease. Most of us might know someone who has been affected by cancer, but many of us might not fully understand what it is. My name is Thomas Taylor, and today I want to provide you with a basic understanding of what cancer is, so that if it does enter your life, you will have a basic knowledge of it. The information that I gathered comes from medical journals, medical magazines, and medical professionals. The main things that I would like to cover are what cancer is, how it spreads, how it is treated, and some of the things that you can do to lower your risk of getting it. First, let me talk about what cancer is. The Salem Encyclopedia of Health defines cancer as a term for diseases in which abnormal cells divide without control and can invade nearby cells. When cells divide much more than they should, and when cells are fail to die, they can create a tumor. A tumor is an abnormal mass of tissue. Tumors can either be benign, meaning they are not cancerous, or malignant, which means they are cancerous. Now that we know what cancer is by definition, let's talk about how it spreads. Cancer typically starts in one location. This is called the primary site. When cancer spreads, this is known as metastasis. This is when cancer moves from the primary site to a secondary site. And sometimes, if the cancer is aggressive enough, it can spread to more sites. Often, people think that cancer is hereditary. However, only about 10% of cancers are hereditary. Some cancers that include bone cancer, breast cancer, and kidney cancer. Now that we understand what cancer is and how it spreads, let's talk about how it is treated. There are a few different ways to treat cancer. I will talk about two. First, there is chemotherapy. Chemotherapy is the use of drugs to treat or kill cancer. Chemotherapy works by stopping or slowing the growth of cancer cells, which grow and divide quickly. It can also harm healthy cells that divide quickly, such as those that line the inside of your mouth and intestines, and they can also cause your hair to stop growing. Next, there is radiation therapy. According to the Mayo Clinic in 2019, radiation therapy is a type of cancer treatment that uses beams of intense energy to kill cancer cells. Knowing how cancer spreads and how it is treated, let's talk about some of the measures that we can do to lower our risks of developing it. According to the People magazine in 2019, research found that exercising is linked to lowering the risk of developing cancer. We can do this by performing 2.5 to 5 hours of activity each week. Doing this can reduce our risks of cancer up to 15%, according to that same survey. Another thing that we can do is cut out unhealthy foods. This includes no smoking, limiting our alcohol intake, and eating more fruits and vegetables, protecting your skin from the sun, and also avoiding tanning beds. This concludes our discussion of cancer. We talked about what cancer is with a definition from the Salem Encyclopedia of Health. We talked about how cancer spreads through the process of metastasis, how cancer is treated with methods such as chemotherapy or radiation therapy, and finally, some of the prevention measures that you can take. Cancer is hard for many people to understand, but with this brief information, hopefully you can have a better understanding of it. Thank you.